patients can see results after these procedures almost immediately. In a lot of cases, patients who've had long-standing issues with veins that have chronic swelling, have chronic skin changes, can have to understand that this has been a long-standing problem and it doesn't reverse itself overnight. But a classic patient who comes in with superficial vein reflux in the saphenous vein and has some varicosities coming off of that refluxing saphenous vein, you can ablate that vein and remove the residual varicosities in the same session, and a week later their leg is basically looking and functioning normally. Short answer is not. In terms of the correlation between heart health and vein health, there's really not much correlation other than symptoms can overlap. And what I mean is oftentimes patients with venous insufficiency will present with chronic swelling, but you can get swelling of the lower extremities from heart disease, as everyone knows. So the symptoms can overlap, but there's really no cause and effect between the two. Yes, so oftentimes in a patient who we suspect may have heart disease, we'll get that evaluated before we'll treat their venous insufficiency, just to be sure that, obviously you would want to take care of the heart issues prior to taking care of the peripheral venous issues. But usually between the history and a physical examination, you're able to evaluate both at the same time and determine if really there is a heart issue that needs to be addressed. But just because one has venous insufficiency doesn't mean they have heart disease, and just because they have heart disease doesn't mean they have venous insufficiency. So I'm excited to do this because I want men to know that, number one, they should not be embarrassed to come forward and show their legs and admit that they have venous insufficiency, because a lot can be done to take care of it. And as I mentioned, and I do mention to patients, this is a quality of life issue, okay? Contrary to peripheral arterial disease or, heart disease, this is much more common than both of those. And both of those get significantly more press, I think, because it's impressive when somebody has a heart attack, and it's impressive when somebody, potentially can lose an extremity from peripheral arterial disease. But patients with peripheral venous disease, they kind of suffer silently because it's not well known, and the point I'd like to make to men is that you don't need to suffer silently, and you don't need to miss work. You don't need or miss a lot of work. You don't need to kind of live with a condition that can be easily treated as an outpatient. And just as women enjoy the opportunity to have their legs look and feel better, men should have the same opportunity. And we welcome the opportunity to take care of you.